Hey, my name is Juno. I'm a fifth year Emory ENT resident. I'm just going to do a quick video to go over how to prep an arm. This is meant for junior residents as well as medical students rotating with us. So first thing, I have two 1000 dressings, Mastisol, and an arm tourniquet. There are different sizes for different types of tourniquets. The one that we're using right now is Striker, and I don't know the length of the band, but it's like 24 inches. If they're bigger patients, then there are bigger tourniquets. So just ask your scrub nurse to see if there are different sizes for it. So let's go into prepping the arm. So within the tourniquet bag, the Striker bag, they have a stockinette in here. So that's the first thing that we slide up. You want to get past the antecubital fossa and really push it up towards the armpit. And then here we're unwrapping the Velcro of the tourniquet itself and then putting it around the arm and making sure that the tourniquet is around the stockinette itself. And you kind of have to unravel it and make it so it's relatively tight. So you kind of pull it taut and then wrap it all the way around, making sure those two threads are out. Looks like it's kind of tucked in right there. So the first thing is you wrap around the Velcro. We're going to pull it tight right here. And then we have, there's like two ties that you can just go ahead and do a nice knot on. Oh, and then you can see those white tubings are how the pressure goes into the cuff. You want to make sure that's pointed up towards the armpit so it's not going into the surgical field. And you can see I'm pulling it up, so it's going up. It's a little nuance that will be greatly appreciated when you do this next step. So this is Mastisol. It's some sticky stuff that will help the 1000 dressing stay on the arm. So you might need one, might need two, kind of depends on how big the arm is. We're making sure we go all the way around it. Give it a few seconds to dry up. And again, you can see where the antecubital fossa is, where the arm bends, and she's flapping to dry it up a little bit. And then use the 1000 dressing. There's a little sticky paper that you have to peel off there. And she goes for peeling off the entire backing and going around. You can start it and peel it at the same time. It kind of depends on your style. I think either way it's perfectly fine. So make it taut right over the Mastisol and go 360. Looks like this patient's arm is small enough that we can just go around once with it, and then you want to kind of tuck everything proximal towards the body. And that's it. That's all you need for prepping the arm. Not too difficult. Any medical student is more than welcome to help out with it. We've had some great medical students take the initiative to learn how to do that, and it's definitely a big help. This next part, I'm going to show you how to prep the arm site. So I'm going to get some sterile gloves here, put it on sterilely. And we used to prep with betadine, which used to be a lot easier because you didn't have to wait nor hold the arm up, but we have since changed to ChlorPrep. So one of the circulators opened up a ChlorPrep stick for me. Key thing is you only pop it once. No shaking because there's glass in there. You will get yelled at by your circulators or your scrub to not shake the ChlorPrep. So you pop it once, go back and forth over the surgical site. Remember, the forearm is the most important site. So what I like to do is after I get the surgical site, I like to prep the thumb first, use that as kind of a leverage to hold up the arm, then I start getting the fingers. So getting on the top of the finger, behind the finger, in between the finger. And basically giving myself space so that I can eventually grab the other parts of the hands. And lots of times, let's see what I do here. Lots of times I like to grab the wrist after I prep. So yep, there you go, grabbing the wrist. And you can see here the trick is to minimize the amount of time I'm holding the arm up, because again, once we're done prepping, we have to hold this up for 3 minutes to let it dry before the scrub can put some towels down and make it a sterile field. So really trying to maximize the efficiency of when I have to hold the arm. And again, kind of going back and forth. And usually at this time, you coordinate with someone prepping the actual surgical site of the head and neck. And then looks like I have a helper here who puts sterile gloves on, and they will hold the arm while I probably go scrub in and get my loops on. And that is how you prep and scrub a forearm. Let me know if you have any questions.